Our country is getting older, but a recent study shows most Americans are not prepared for the complications that go along with living longer. I'm Lee Zurich.
And I'm Tisha Powell. At some point, the body slows down, and even those without major health problems may find routine tasks like housekeeping overwhelming. Others may struggle with basic activities needed to live independently, like bathing or preparing food, and eventually they're no longer capable of living on their own.
According to a 2019 report by the federal government, nearly 70% of older Americans will require long-term care in their lifetime, and the cost of that care can be staggering. A private room in a nursing home, which comes with 24-hour skilled care, tops nearly $130,000 a year, while the median monthly cost of an apartment in assisted living is nearly $5,200.
For families without a plan, care for an aging loved one can quickly become overwhelming. Senior advocate Andrew Mull says many people also misunderstand what Medicare covers.
I think a lot of times people assume Medicare will be the safety net that will allow their loved one to be cared for, but Medicare is a very short-term program.
In Louisiana, a family admits they were not prepared when dementia started affecting their matriarch's mental and verbal abilities.
Reporter Liz Reyes shares their story, explores the cost of aging, and what it takes to provide someone with long-term care.
Lela Campo is a beloved great-grandmother who loves to dance. She's just as stylish as she was in her younger years, and she just celebrated a big birthday.
I'm 100 years old.
At 100 years old, she's still active, but her daughter, Joyce Campo, says dementia has deeply impacted her mentally and verbally. It started while her mom lived with her, even with help from home health care. It's a challenge many families face with aging parents. Joyce says she and her brother didn't expect it and didn't plan for it.
It's kind of like a brick wall coming at you, you know. It's, it changes your life. We saw Mom as being very independent, and we just thought she was going to live on to be that.
Thankfully, she's now thriving at the Summerfield Senior Living in Slidell. But Joyce and others warn that having a care plan before a medical emergency is critical. Elder law attorney Alice Grooms says the first step, prepare legal documents.
You want to have that power of attorney. You want to have that medical or health care directive. You definitely want to look at a last will and testament. You need to have that information to someone who's going to take care of that and make sure they can look out for you.
Financial advisor Mike Martinez says planning for the cost is just as important because Medicare and Medicaid don't cover long-term assisted living. In Louisiana, those facilities cost about $3,900 to $5,900 a month. Martinez says long-term care insurance can help.
There's two ways you can do it. You can buy traditional and pay monthly and take a policy out on your mom. Or you can buy the alternative long-term care and say, I can afford to put money in here. Why? Because I'm not going to abandon my mom if my mom or my dad gets sick.
Martinez says premiums range from $90 to $500 a month, depending on age. Eligible low-income seniors can receive full Medicaid funding for nursing homes. It can also provide home health care help, but there's an issue with that service. Right now, there are close to 12,000 people on Louisiana's waiting list for that critical home care assistance. And that means many of those seniors are waiting at least 10 years or more before that help arrives. Advocates for seniors like Andrew Mull say severely ill seniors can get help at home faster. But he says the wait list shows that the state prioritizes nursing home care over home-based care.
If you want to live at home and stay with your family and your friends, you're going to have to wait. If you want to go into a facility, you can go into a facility.
State lawmaker Kirk Talbot says the new federal Big Beautiful Bill provides more money for home health care, but he says he'd like to see the state boost funding too.
The best way to do it is look at the data from those other states, talk to the secretaries of health and hospitals in other states, talk to legislators that have done this.
Families like the Campos agree more funding is needed.
Could take care of those that really can't take care of themselves anymore.
Do you like your nails? Is it a yes?
Yes.
Joyce is grateful her mom is getting the care she needs, but she hopes other families realize how quickly things can change and start planning now for their loved ones.
Some people receive unpaid care from their family, and a study from AARP shows that at least 53 million Americans are not paid.
A bipartisan bill in Congress called the Credit for Caring Act could help ease some of that financial burden. The legislation would provide a non-refundable federal tax credit up to $5,000 for eligible family caregivers. Democratic Representative Linda Sanchez and Republican Senator Shelley Moore Capito are among the bill's bipartisan co-sponsors and say it's personal, in part because both lawmakers helped care for their own elderly parents with Alzheimer's.
I know from my own personal struggle, wanting to do it the right way, it became incumbent upon me and my brother and my sister to care for them. Well, you can imagine we're all in different places. It became very expensive.
I come from a family of 7 children, so when you divide the financial responsibility and the caregiving responsibility among 7, it's much more manageable, but many families don't have that luxury.
The proposal so far has not advanced in Congress.
But Oklahoma in 2023 became the first state to adopt a comprehensive caregiver tax credit up to $3,000. And Nebraska passed similar legislation the following year.